Hi, good morning, folks. This is Chris Peterson here. I am chairing this week's Public Safety Committee meeting. My associate, Dr. Askham, has surgery early this morning, so he could not make it. So he's asked me to chair the meeting. It is September 17th, 2020, and we will start with the roll call. Melissa Appleby.
I'm here. Good morning.
Great. Sean, thank you. As we know, Sean's out. Chief Baldus.
I'm here. Thank you.
You are, sir. Good morning. Mike Berry.
Here.
Good morning.
Good morning.
Chief Walter.
Yes, good morning.
Good morning. Maria, I heard you on.
Morning.
Good morning. Kristen Formanek.
I'm here. Good morning.
Hi, good morning. Jennifer Kurtanis. Jennifer Kurtanis. Going once, twice. I'm sure maybe Jennifer's got more important things.
She's there.
No, Jennifer's on.
Oh, she's on. Just couldn't hit that.
I think her volume's not working.
I love that. Okay. Mark Tritz. And Mike Long. Melissa Marquis. Oh, our friend Mark Massaro from Eversource. Okay, Sarah Nielsen.
Present. Good morning.
Hi, good morning, Sarah. Myself. Tom Roy, I saw you're on.
Present.
Thank you. Nancy Sheets.
I'm here.
Hi, good morning. Karin Stewart.
Good morning. I'm here.
Hi, good morning. Neil Sullivan. Neil, you on mute? Are you there? Well, maybe Neil will jump on later on. And Gary Wilcox.
I am here. Good morning.
Good morning. Okay. Thank you, folks, for joining. So, Chief, would you mind leading us in the Pledge of Allegiance, please?
Absolutely. Thank you.
Thank you.
I pledge allegiance
Pledge allegiance to the United States of America, to the Republic, for one nation, God, indivisible, with liberty, justice for all. Thank you. Thank you. Okay. Do we have, Maria, do we have any, or Tom, do we have any public audience comments today?
I didn't have any filter in.
Nothing filtered in. Okay, note that. Thank you. And formality approval of the August 20th, 2020 minutes. Any questions, concerns, comments that should be noted? Thank you. Okay, we'll move to approve those. And get right in. As much as I like to hear, you guys know I like to hear myself talk. I have a competing meeting shortly, so we'll try to move right through this agenda. Updates right away. Farmington Valley Health District, please.
Okay, can you guys hear me?
Yes.
All right. I'm hearing feedback. Hold on one sec.
Put my.
All right, I will do this by phone. Our data and numbers continue to track positively with less than 10 new cases throughout the Farmington Valley in a week. Our positivity rates are less than 1%. We are posting weekly data updates on our website at fvhd.org, and it does include the new school metrics that we are calculating for the Farmington Valley Health District. Currently, our school metrics for in-person school is at 1.4 new cases per 100,000, which continues to support in-person school days. We have been working exceedingly closely with our school systems and the Simsbury school. We support 10 school districts. We meet weekly with all of the superintendents And I really want to thank our school administrators for their extraordinary work and the partnership and the communication. As you can imagine, there's a lot of new expectations of our schools, and tracking of data and working closely to make sure we keep that environment as safe as possible has really been central part of our work in the last couple weeks. I want to emphasize that we are working collaboratively with the Farmington Valley VNA to offer flu clinics. 2 of those will be offered September 30th and October 7th. There is online registration. We still do have some slots open. People can find that registration on either the VNA website or the Farmington Valley Health District website. It does require pre-registration to help move the vaccination process quickly. I want to thank all of our emergency management and first responder support. This is not only going to be an opportunity to vaccinate people for flu, but also to test our ability to do flu clinics or any kind of vaccination clinic in a socially distanced way, and prepare us in the event that we have COVID vaccine that needs to be administered to the general public. I want to also encourage individuals that are seeking tests to please stay home until they receive their test results. If you are seeking a COVID test, in all likelihood, you are doing that because you have some symptoms, you were concerned about an exposure, or you're just concerned about having COVID. So until you have those test results, please stay home in the event that you do test positive. This certainly reduces the contact tracing that we have to do during the period that you may have been infectious. With that, I will end my remarks unless people have any questions.
Thank you. I do have questions around that and around schools. So if I understand correctly, because and as a parent, but also as somebody who spends a fair amount of time around other parents and who are asking me sort of these converging questions, and I know Neil may be joining later on, or already has, or maybe joining. So if I'm not asking for the specifics, but if I understood correctly, is it a to determine whether or not the school attendance dynamic plan changes, which it sounds like, so you folks have given them guidance on certain numbers and parameters about distilling it down, if kids can be in school or can't be in school. Is that a fair statement to say? You're the governing guidance for them?
The State Department of Health and Department of Ed, in consultation, established overall metrics that are available that articulate what types of metrics we use to determine full in-person school, a hybrid model, or complete remote learning. We calculate those same metrics for the Farmington Valley, and we make those available to our school districts every Thursday evening or Friday morning.
Okay, so state guidance has a maximum, let's say, threshold that simplistically as a maximum threshold that would allow for a positivity rate that would allow for children to stay in school for traditional learning. You folks know what that threshold is, and you are the folks who do the local level calculations for the respective towns that have asked you to assist them. Fair enough statement?
Yep. We do it for the entire Farmington Valley.
Okay.
The state releases it for the county, and we do it for the Farmington Valley.
And then this question may be for Neil though, right? But we can, if we start bumping up against if your numbers show that we were bumping up against the threshold that would require a change, I imagine that we don't need to wait till that threshold. Is that correct? We can make a decision at any point on our own to change the learning dynamics and who's in or out of school. Fair statement?
I think that is fair, and we have also communicated that if we see any unique situations, unexplained clusters, if we have to quarantine a significant portion of a school because of a close contact, we can make individual decisions as well about what might be in the best interest of either that school or that school district.
Gotcha. Okay, thank you. I appreciate that, because that's really what I feel, that sort of just common question, whether it's at Fitzgerald's or, taking a walk or whichever, or certainly at whatever the sports that are going on now. So I appreciate that. And, thank you. Maria.
Great. Good morning. Thank you.
Good morning.
I'll lead off this morning with just a very quick overview of continued work post recovery from Storm Isaias. And again, I think Mike Berry will cover more of this during his report. But just at a high level, Chief Baldus, Chief Boulder, Mike Berry, myself, Tom Roy, we recently met to conduct our after action review. I think overall, we were really pleased with our local and internal response to the storm efforts. There's always room for improvement, and we did find some recommended areas of improvement for the future. But again, I'll let Mike go into that more during the emergency management overview. We are working on requesting a meeting with Eversource to talk about our frustrations with their storm response. Have not been able to firm up a date on that yet. Multiple of our local government organizations, such as COST and CCM, have been granted intervener status in the PURA proceedings regarding Eversource. So I think that's important just in terms of, at a regional and a statewide level, that our municipal voices are being heard on that matter. And at a staff level, we're currently working on processing potential FEMA reimbursements related to the storm. For our coronavirus update, for our next phase of reopening municipal services and buildings, we are preparing for a soft reopening of Town Hall and the library for walk-in visitors. We will be announcing that tomorrow with more details, including the reopening date. When we initially begin to welcome back in-person visitors, there will be limited hours and limited uses during that phase of reopening. We still continue to have our staff whose primary work location is indoors, working at approximately 50% capacity. So those staff members are doing a combination of both in-person and remote working. And I want to just give a giant thank you and kudos to our facilities folks within the Public Works Department. Tom Roy and Mark Rustick and their team have been working really hard to prepare our buildings for welcoming in-person visitors. Our senior center will remain closed until further notice. We are beginning to expand medical services that were previously provided, and Kristen will elaborate on that more during her report later in the meeting. I'm very pleased to report that our Parks and Recreation Department had a successful summer season. We were able to modify our pool and summer camp practices. But again, big thank you to John Tebow, Tom Tyberski, and Orlando, and the rest of the folks in Parks and Rec for their hard work this summer. I'm just so impressed at what we were able to do in providing, again, a safe pool season, a safe summer camp season for our families under the circumstances. They just did a phenomenal job. We're continuing to distribute information about the travel advisory. We're typically doing that on a weekly basis. So we are widely distributing that information, particularly through our social media accounts and our website. And what we're doing as locations are either removed or added from that list, we are doing our best to share that information with the public just to help raise awareness about that. And we are still screening patrons for municipal services based on that travel advisory, and we will continue to do so when we welcome back in-person visitors to our buildings. The no cash payments has been extended through January 1st. At this time, we are still accepting payments by check, by credit card, by debit card. We've actually found that this has been very successful. Since we implemented this, we have only had one complaint. That was from a resident who wanted to pay for car taxes in cash. Aside from that, we have not had any issues, any complaints. It's worked really well. We think it has definitely helped cut down on some of the transactional sort of work between our staff and the public. So again, we're going to be continuing that now through January 1st. We are continuing to process a large number of absentee ballot applications, and then we'll be transitioning into the absentee ballot phase in October. The town clerk's office is actually responsible for that by statute. Due to COVID-19, all eligible voters may choose to do so by absentee ballot this year. In regards to the volume, in a normal presidential election, we would process about 1,500 to 1,800 absentee ballots, but we're estimating that we'll be processing in excess of 10,000 for this election. So we have had to bring on a number of temporary staff members to help us process that volume of applications and ballots. The absentee ballot applications have been mailed to our residents, and the ballots themselves will be available around October 2nd. And we do have 2 secure drop boxes at Town Hall. We have a drop box that is secure that you can leave your application if you do not want to mail it and do not want to come in person. It's right in front of our main entrance. And then once your ballots are complete, we also have a secure ballot box that's clearly labeled in front of Town Hall as well. So for folks who truly just want to take care of that process with no human contact, they absolutely are able to do so with those drop boxes that are in front of Town Hall. Just a quick summary of some of our open facilities and programs. Again, our parks, open space trails, parcels, our open space parcels, our tennis courts, skate park playgrounds, basketball courts all remain open at this time. The golf course continues to have a successful season, and the restaurant is open for outdoor dining, along with the golf pro shop is open for retail. Many of our organized sports are using our related athletic facilities at this time. The transfer station is operational, and the library continues to do curbside pickup. They recently expanded that service to include evening hours on Tuesdays. And they are also taking appointments with the public who need access to various technology, whether it's a computer, the internet, printers, that sort of thing. At this point in time, our public meetings are being held virtually until further notice. We did recently receive some updated guidance from the governor's office this week, as well as staff at the Freedom of Information Commission. So we are reviewing that with our town attorney. And if that virtual status of meetings is going to change, we'll be sure to notify the public about that. And lastly, just want to encourage folks, if you can, to please donate to our food programs. There's a tremendous need for that right now. Our food programs are managed by the Social Services Department, and they do rely entirely on donations for that program. And again, I'll let Kristen elaborate more on that later in the meeting. And that concludes my report for today, unless there are any questions.
Any questions for Maria? Any folks? Okay, thank you, Maria.
Thank you.
So under emergency, Maria, you can help me with my cliff notes here. Under the emergency management section, who picks up are we ready to talk about the storm response?
So we'll turn the emergency management update over to Mike.
Okay, Mike, thank you. I didn't know if it was a team effort to address each of these. Okay, thank you, Michael.
It's really been a team effort behind the scenes, but I'll be the spokesperson for what we.
That's what I meant.
Yeah.
That's what I meant. There was multiple participants in the response to item number 3. Thank you. Go ahead, Mike.
Well, we've been continuing to talk about this for over a month now, and hopefully we can start winding this down and getting some things accomplished. We did have a post-incident analysis amongst the Unified Command to discuss the storm response. We all came to the conclusion that everybody did a fantastic job, and there was kudos to go around to everybody for their performance, their professionalism, and being able to try to get the situation made safe and to try to start the recovery as fast as possible. We're continuing to work with Eversource to try to straighten out that problem, which has been again talked about. So some of the things that we came up during the post-incident analysis is we're going to continue with working on checklists to be put into the emergency operations plan, working on redundancy if a department head is not available and a substitute person is being able to step in. The checklists will have a definite procedure to follow that will be no matter who's in charge or who's doing the performance, and everybody will know what needs to be done at what time frames. We're also going to be working on checklists for what to do if we run into the situation where we have severe weather watches and severe weather warnings. We want to make sure that our first responders and our residents are safe. So we're going to be coming up with checklists on what to do in those situations and what needs to be put out to the public in that capacity. We're going to be reviewing with Eversource when we have our meeting with them, the priority lists with them to make sure that the highest priority facilities and the critical infrastructure is coinciding with what we want is to the list that they have. We'll also be reviewing the contact information and emergency procedures with some of our other outside agencies, such as the power, cable, and telephone services that we found lapses during the storm and the recovery afterwards. We found some issues that we need to recover. We want to make sure we take care of those on blue sky days. We did come up with a list of things that we want to go forward with. There is a checklist put out, and there's no time frames on those checklists just yet, but things are going to be worked on, and hopefully we can go forward and get some of those things taken care of. As for the COVID response, there's really not much of a report on my end. Most of it was taken care of by the Farmington Valley Health District. We are going to be helping out with that flu clinic on October 7th, and we are looking forward to it. We look to get a lot of people in there and get as many people pushed through in a timely manner. Again, it's not only to conduct a flu clinic, but it's also a procedure and a preparation for if we have to do things on a mass scale for the future. We want to see if that procedure and those that area, that facility would work for what we wanted to do. And that's about it I have on my aspect, and I'll turn it back over to you guys.
Great, thank you. Thanks, Mike. Maria, do you have any comments to add?
No, I think Mike did a great job.
Great. Jennifer, are you still on?
Yes, I am.
So back to the flu clinic question, just as maybe this was said and I was just typing and I apologize. Will children of any age be eligible to be participating in the clinics?
9 and above.
Okay, 9. Okay, great.
And we have been talking to some of the pediatricians. There are some pediatricians that are actually doubling up their efforts to get their patients vaccinated. Some are also contemplating small drive-through types of events, but on a appointment basis.
Got it. And Maria, from a functional standpoint, obviously we can't mandate flu shots for town employees with any organization. But do you have any perceptive, maybe even Chief with yourself, Chief Bolter, do we have an idea, seeing as how critical our town employees are? Do we ever have a perspective as far as the take up percentage on flu shots amongst our staff? Do we do our own flu clinics at town hall?
Yeah, that's a great question, Chris. So I don't know the percentage of our employees that opt to do the flu shot on an annual basis, but we do offer a number of flu clinics to our staff. So actually, we just had one this week, but we'll typically offer about, Melissa, please correct me if I'm wrong, I'd say about half a dozen different sites, usually throughout the fall, and that's just open to our workforce and their family members.
Gotcha. Okay. And last point on that, Jennifer. I guess there really is, you can get the flu whenever, but there certainly seems to be a seasonality concept to when the marketing for flu clinics and shots comes out. Is the messaging that we should be telling educating ourselves, but also our residents, you should have received best practice is you should have received a flu shot by no later than what date to create the herd immunity?
Yeah, Nancy can chime in, but the message is get your flu shot whenever you can, and it's not ever too late. Flu season can run into the spring, but we're just encouraging people to get a flu shot as soon as they can, and it's not ever too late.
Okay, thank you. I just know that there's the concept of herd immunity is critical, and obviously if that's concentrated at one period of time versus spread out, then it's far more effective. It really isn't. So, all right, thank you. Chief Bolter, please.
Hi, good morning, everyone. Just a real quick couple updates on the sector rules. Governor Lamont came out with a new executive order with a fine schedule for any violations of wearing masks or hosting parties or attending parties that are in violation of the sector rules. Just so people are aware that the town several months ago set up a town ordinance that allowed us to do that. And again, our number one objective is compliance, and we feel that our number one method of gaining compliance is through education. So we shouldn't really see any changes here in town, except this is an additional option for us to use and for obviously other municipalities to use if need be. We have already spoken with Kristen, and we're now going to continue our push to distribute some of the masks that social services has been able to collect through donations and other sources, especially since this announcement came out. We want to make sure that people have access. So we'll be out in front of Eno at different times during the week, periodically, to try to push those masks out to those who need them. Do I have the availability to share my screen?
Should be able to.
Okay, I just wanted to share something. It's disabled right now. Maybe
You should have access now.
Okay. Yeah. So just moving on quickly, unless there's another. If there's any questions about the sector rules, just wanted to share this graph here about motor vehicle thefts in Simsbury. So we're continuing, obviously, to see cars being stolen. All of the cars are left unlocked. Keys are accessible, or key fobs are accessible. Same theme we have been seeing now for several years, as you can see by the chart. Starting in 2017 was the big jump. And this is not unique to Simsbury. These are discussions that we are having with municipalities throughout the state. We are looking for ways to prevent this from happening. And, time and time again, we come to the conclusion that the number one way to stop this from happening is to stop the availability of this to people who are stealing the cars. And it really comes down to the simple concept of just locking your cars and keeping your keys or your key fobs inside or inaccessible. We have had cars that have been taken from garages that are left open and the keys are left in them. We've had cars that have been taken just in the driveway. People are running through their neighborhoods and trying to just unlock cars. They go through the cars. If they find keys, then they can take the car. So, we have put a major focus on, especially during our midnight shift, on sort of omnipresence all throughout town. We've run into people trying to steal cars. They have engaged in pursuits that we have not been able to continue. So we're going to amp up our educational aspect, starting with posting the thefts much more frequently through social media, starting with yesterday, and just giving some people some information about where these cars are going afterwards. And we have had cars that have been recovered with bullet holes in them. We have had cars that have been used in violent crimes that have been stolen here from our town. In most cases, all of these cars are being found, and they're being found locked with some damage to them, some receipts in them, some contraband in them, all sorts of things in jurisdictions such as Hartford, sometimes Waterbury, on very rare occasions outside of the state. But the theme is very common here. So I think that if the community all realizes the importance of this, then we can definitely slow this down together. And I think the community is the major factor here in us stopping this. But just looking at that chart, so that number has already gone from 25 to 26 as of yesterday. And the projected number is 34. It's just simply taken over the last 2 years what has happened between September and December of last calendar year and the calendar year before that to get us up to a projected 34. Hopefully we will not get to that number, but we are anticipating that that's what we're going to see. So we're going to look at enhancing our campaign. Please spread the word as much as you possibly can. Any questions about that?
Chief, if you could put something together for WSIM, I'd be more than happy to put it in the rotation.
Certainly will, Mike. That's great. Thank you. If there are no other questions, well, then I have one other topic to address unless there are other questions beyond that. Just a reminder about non-domesticated animals in town. If you happen to see any animals that are acting what you would consider sort of out of the norm, please don't hesitate to call us. So we had an incident yesterday on Hoskins Road where a woodchuck was acting very strange and attacked a homeowner. And he called the police, and our animal control officer, Mark Rudowitz, responded. And the hedgehog then attacked him. He was quick enough to not have any interaction with the hedgehog, but it chased the both of them all around the property. It was really quite amazing. Mark Rudowitz has never seen anything like this before. So just a reminder, I know the focus has been on not feeding wildlife, the bears and the coyotes, the fox, but and occasionally we have concerns about skunks, whether they're rabid or not, and then raccoons. Just keep in mind there are other wildlife out there as well, and if you see some strange activity, do not hesitate to call us, and we'll help out with that. And that's all I have for today.
Thank you, Chief. Sounds like he just got his property tax bill. I appreciate the update, and I'm glad that Sean wasn't here for the car theft portion. Since I wanted to take the opportunity, I know that it's a bit of a different forum, but if anybody has the opportunity, and certainly the public who's watching, I would encourage them to view the video minutes from this past Monday's Board of Selectmen meeting, where Chief Bolter gave a very in-depth and impressive and important presentation on accountability, police accountability, and the steps that he and his department are undertaking. And very well done, and very, very sincere, and very important that I think all of us collectively see what's been in practice and what will it will be continue to be in practice and improved upon. So thank you, Chief.
Thank you, sir.
Ambulance.
Yes, good morning, everybody. My report will be short, which I guess is a good thing. Everybody, all of our crews remain healthy. Our call volume has been still very flat, which is good and bad. I want to remind people still, to please call us. Don't hesitate. If you have any health concerns, we're still here for you. The state is no longer passing out any more PPE, but we still have a fairly good stock, including masks that are what I would consider non-medical grade. So Sarah or the VNA, if anybody needs other masks, we're willing to share what we have in our, our stash that we have in our garage. So please let me know. And that's really all I have to say. Everything has been nice and uneventful for us. So if anybody has any questions, that's all I have to report.
Thank you. Thank you. Chief Baldus.
Yes, good morning.
Morning.
Yeah, we're similar to the ambulance. We can report that we've had no infections and no exposures. Our department continues to remain very healthy, and the volunteers continue to do a great job in responding with the methods that we have put in place to make sure that they are continuing to be protected and also continuing to protect the public when they do go out for responses. And basically what I want to talk about this morning very briefly is everybody is certainly quite aware we are into a significant dry spell here in Simsbury and in the area in the region. We have a lot of outdoor activity and I would expect that to continue. And we want to make sure that people are maintaining a fire safe environment and also be very, very cognizant and aware of the dryness that we have. The fire danger continues to remain high, and therefore there is no open burning. Any burning permits for campfires that have been distributed are right now no longer being able to be utilized because of the high fire danger, and we certainly stress that. We don't have an open burning policy in the town of Simsbury, so therefore, as we get into the fall cleanup period, no leaves, no brush, no sticks, that type of thing can be burned on your property. And especially this year with the dryness, we have to be extremely careful about that as well. So certainly we want to make sure that everybody stays safe, but also keep your properties and lands safe as well. The other thing, as we go into October, that is also the period of time that traditionally we have our fire prevention period. You'll be seeing a lot more activity from the fire marshal's office. Banners have already gone up. This year's theme is safety in the kitchen. Again, with people being home more often and doing a lot more things, in family environments. Certainly, the potential for kitchen accidents, kitchen fires is there. So we want to make sure that people are being aware and fire safe in their activities around the kitchen. And also, this is the time to be looking and checking your smoke detectors and carbon monoxide alarms. One of the things that we want to, again, encourage people to do is not only just change the batteries, but also maybe take a look at the date of manufacturing on the detector. If you take the detector down off your ceiling and look at the back side of it, there should be a manufacturing date. If that date is 7 to 10 years, time to replace it. Even if it may be working okay, the manufacturers really are saying that 7 to 10 year period is a lifespan and it should be replaced. Many of the local hardware stores have them available, and they are now available with 10-year life batteries. Which means which is nice, you can actually put them up one time and not worrying about a battery replacement every year, as the battery technology is improved to such a point where they can be reliable for 10 years and have an automatic system inside of them to alert you if in fact they go into any kind of a malfunctioning mode. So this is the time of year to check those detectors and CO alarms to make sure that your home is safe. So that's what I have today for you, Chris.
Thank you, Chief. Always a critical message, and probably one of the biggest offenders about stretching out detectors of any kind and just assuming that once you put it up, the same thing with a fire extinguisher. Now, I think we got a fire extinguisher in our kitchen I think my parents put it there when I was in college, and I just assumed that it's working. So thank you for always reminding us.
Chris?
Yes.
Just a quick question for the chief. What's the drought? Is there any indication that either the town or Aquarian or what have you is going to be asking for residents to reduce their water usage? Or, I mean, are we getting close to that point, Chief?
We have not heard that at this point from Aquarian. Obviously, we're in touch with them on a regular basis because certainly they provide the water for our fire hydrant system as well. And right now we're holding our own with water levels, but it is something that's monitored on a day and weekly basis. Any change certainly would be communicated immediately to you as well as to the general public.
Thanks, Chief.
You bet.
Maria, I haven't heard anything on that. Anything to comment?
Sorry, I was just distracted by a staff member walking in. I'm sorry, what was the question?
The question Sarah posed around the chief's comments to the seemingly dry season, high fire danger. Sarah's question was, have we been approached by Aquarian at all relative to water conservation?
Not recently.
question.
So we did have quite a bit of conversation, obviously, with our water utilities back in late June through mid-July, but things had stabilized a bit at that point, and they have not asked us to push out additional information this time.
Great, thank you.
You're welcome.
This is Jennifer. If I could just,
Go ahead, Jennifer.
yeah. We would encourage individuals that have private wells to try and, take steps to conserve water, not leave faucets running while people are brushing their teeth, not washing cars, that type of thing, as we continue to experience this drought.
Thank you. Great insight. I appreciate that, Jeff. It's wonderful. I did receive a note that the Board of Ed, the folks representing Board of Ed and schools are elsewhere with their attention this morning. So we will move on to Public Works. Tom Roy?
Oh, good morning. I guess a couple of quick things. One, just to follow up on the conversation of the drought, I think it is something we all need to be watching closely, as we are now listed as a severe drought, which is pretty significant for this region. So hopefully we get some rain soon. Our department has been working very closely with Mike Berry and Amy Merriweather on the FEMA reimbursement. Right now, it does look like the town is eligible for reimbursement for some of our costs in the storm cleanup associated with the tropical storm. We also are working with Tetra Tech, which is our on-call FEMA consultant. They're going to help us a little bit with the FEMA reimbursement, but we're also going to be putting out a bid for debris collection. So in the event that we are hit with a large-scale disaster, we'll have an on-call vendor that's going to work directly for the town for the cleanup. That bid should be coming out later this month. And as Maria mentioned earlier, with the buildings and the soft reopening, our facilities department is very active in making sure that we get everything right, so that when we open things up, everything goes smoothly for both our residents and our employees. That's all.
Great, thank you, Tom.
Thank you.
Kristen Formanek, Social Services.
Good morning.
Good morning.
I have a few updates for you that have slightly been touched upon already. As Maria shared, we continue to manage our food programs, and I know that you've heard me say that it's bigger than it's ever been for us. We are almost at a double capacity for what we were serving pre-pandemic. We had our 9th distribution this week on Tuesday, and we served 137 households. We've also increased where we're getting food from. I'm really excited that we're partnering with the Salvation Army, and they are now delivering 30-pound food boxes to us for each family. And this week we were also able to receive bread. And I wanted to also thank Gifts of Love. Throughout the summer, they've been delivering the produce to us for our food distributions, and that's been a really great addition for our folks as well. We also have started, this was our 2nd distribution, where we've offered additional food to our families with children, and that is through funding that we've received from the Rotary Club of Granby and Simsbury. So thank you to them. And as Maria shared, we are completely dependent on donations. So I'd like to share again that we really are seeking donations of actual food items, non-perishable food items. There is an updated list on our website if you'd like to take a look at that. Also seeking donations of financial donations. We are kind of quickly moving through our reserve funding and trying to continue to support the community with our food efforts and helping people with rent costs and utility costs. So we're going to be putting out the call to the community pretty soon for financial donations as well. As was mentioned, we're also, allergy season. We're also continuing to coordinate the hand-sewn masks. We've received just about 4,000 masks in, and we've put over 2,500 masks back out into the community. And we know that masks is just one of the really important ways to help stop the spread of COVID. Before school started, we did send bags of masks to all the schools in case there's a student or a faculty member that didn't have one day. As Chief shared, we really want to just push them back out into the community. So if anybody needs one, if your family needs one, give us a call. We can definitely get those to you. We also are going to be starting our energy assistance season, and I wanted to share this publicly in case people are listening that do participate in that service. We are going to be able to provide our energy assistance program, but it will be fully virtual by phone appointments, electronic, and utilizing the mail. And that will be starting on October, I believe it's October 5th. It's a Monday. And for the senior center, as was previously mentioned, we are going to stay close to the public. We think that that's a very important thing to help to keep our most vulnerable seniors and individuals with disabilities safe from COVID. We are providing all of our services remotely. We continue to provide lunch on Wednesdays, and we are also still offering the blood pressure and blood sugar screening clinics with the VNA. We're looking to add back in our foot care clinics and our hearing clinics. So once those dates are established, I can share them with you. And we are partnering with the Farmington Valley VNA, thank you, Nancy, to offer 2 flu clinics at for our seniors. And those dates are going to be October 8th and October 22nd. We're still working through the details on that, but folks can go on to the Farmington VNA website and sign up for their flu shot. And we will have the forms that they need at the senior center if anyone doesn't have the ability to print it themselves. And our staff is doing well. We're all healthy, and we're just going to keep going. So if anybody has any questions, I'm here. Thank you.
Thank you, Kristen. It's just, to me, it's almost as if your report every week or every meeting is the most important, considering how direct and tangible your services are on a daily basis versus other folks who are equally important and seemingly on the call, but may have ebb and flow as far as their activities of involvement. So thank you so much.
You're welcome.
VNA.
Good morning, everybody.
Good morning.
As Jennifer has already said, as Kristen just said, we are gearing up for flu season. So we are in the process. We're really excited about the 2 big drive-through clinics that we're doing with the Farmington Valley Health District. It really will be quite an experience. I mean, we plan on over 200 people, if not more, at each event. So we're kind of an all hands on deck on those days. For all of our traditional clinics that we do in all of the towns, at the libraries, at the senior centers, while we're working really side by side with everybody to figure out what's the best way to do those things. We're obviously doing them differently this year. We're going to be offering more of a social distancing practice. So we've got tents in driveways that we're going to be setting up every time we go someplace, so that we've got people managing who can go in the building at what time. We will have a tent here at the VNA. So if you kind of ever wanted to, you could kind of drive through our back parking lot. We have vaccines here at any time. Anyone can call us and say they want to come by. We're able to do that as well. To your with that, because, employers want to make it available for their employees. We have funding for people who don't have insurance. So there's really no reason not to get it or not to have, we have it available. So if anybody needs assistance with that, they could let us know. Otherwise, we are in business, we're busy, and luckily, even with our contacts, we are all safe and healthy.
Wow, that's great. And I didn't know that you guys had such an open program for that, which is wonderful. Maria, maybe we all need more things to do on our plate, right? But maybe somebody in town staff could simply make up a flyer, the informational flyer that just says, I think two things we could talk about offline is one, that we've got the intention to have a coming flu clinic. And second, that the VNA has a program, is it available, and that people should reach out to them. I think that's a completely underinformed service or concept we have in town. So maybe you guys could do something around that and continue that. It's just, I think, us demonstrating in a very simple, low cost, no cost way, collectively as this group on this call is just stewards of the residents of town, pushing forward services. That is another example of just how awesome Simsbury is versus any other place in the world. And I got my flu shot yesterday at a preoperative physical. Just
There you go.
Yeah, I can't be preaching unless I'm practicing, right? Okay. Sarah, Main Street Partnership.
So I just want to start off again with some non-COVID updates. I want to thank the town of Simsbury, especially Mike Berry, Senator Whitcombs, and Representative Hampton. We talked a little bit about the storm results, but there were huge issues with Comcast outages for our businesses, to the essential businesses, resulting in people that were very upset. Their internet was down, their payments were down. And so Mike was really great, and the team was really great in reaching out to the appropriate people. And just to add that, please, to your list as you're revamping what happened, that, Comcast and everything, as soon as we got the power up, that's incredibly important for the business community and the residents. For COVID news, just very quickly, as Nancy mentioned, the VNA has been amazing. Just a reminder, they're also doing flu clinics with our businesses. They're working with Main Street, and we've signed up a lot of our essential businesses where the VNA comes out to the business community and say Fitzgerald's, for example, and will provide flu shots. And Brian actually pays for, out of pocket, his employees that don't have the insurance to cover flu shots. So, it's a great partnership there, and, many thanks to the VNA. The good news as well, several of our larger companies have decided that they're going to be working remotely through the rest of the year, which I think is very, encouraging news. They're taking the safety incredibly important from their employees. A reminder that we have a Simsbury Small Business Roundtable today from 3 to 4. It is with the Lieutenant Governor and our State Representative, John Hampton. Businesses and representatives from Simsbury will be able to discuss COVID-related issues and business assistance, especially as we look to starting hopefully the recovery portion of this. So if you haven't registered, please reach out to either State Rep Hampton or myself. Both myself and the Chamber are also serving as panelists today from 3 to 4. And then final thing is, she won't mention it, but I will. The Volunteer Ambulance Association is doing their fund drive. They have been amazing to the business community. We have enjoyed partnering with Main Street, and you can go on to simsburyems.com because what they've been doing is incredibly important, and they need donations. And that's it.
Great. Thank you. Thank you, Sarah. I think you're fantastic. Everything I hear about what you do for the business community, how effective you are, and how positive your messaging has been throughout COVID and through the storm. Kudos to you. So thank you for that. The one last thing, back to I'm stuck on flu shots. Maria, just thinking about your message you sent to me. I don't know if we can do this. Maybe it's already being done. VNA. I don't know. Understand that there's age cutoffs and all, but could there be a coordination with the schools, especially the elementary schools, that a flyer goes out amongst the 87 other flyers that my kids get a day that says, hey, family members, we have something available to you. Community members, if you're not able to get to your doctor, insurance is an issue with you, whatever, there are services out there to help. Something like that, I think, might be effective. It sounds like I'm spending somebody else's money already. I'm assuming that we've got it. So you guys can take that offline. Last is always the open business, other business. Any comments, questions for the broader group?
So, Chris, it's Neil Sullivan.
Hi, Neil.
Sorry, I was late to the meeting. Apparently, I'm so busy not right now that I can't manage a calendar anymore because I didn't have this on my docket. So thank you thank you to Maria for the reminder, and I made it before you all ended. So thanks for your patience. So obviously we're in week 3 of kids being back in the Simsbury Public Schools and week 4 of our educators being back. It's been a very successful return to Simsbury schools. Pleased to report that our phased in reopening plan has gotten really positive feedback from everybody. And that our youngest learners, kindergarten through 2nd grade, are as of Monday of this week have fully re-entered, and that we stick with our plan right now that on September 29th, all of elementary school will be back in. That's also the target date for when we would try to make a decision during that last week of September regarding what we can do in terms of 7th through 12th grade, which has a little more logistical challenges in terms of just bringing those populations back full bore. I think it's a credit to the students in particular. The mask compliance is a non-issue. It has been tremendous that the students of every age wear the mask without putting up fights and without fussing about it. And that's really been, I think educators were really nervous about whether that was going to be successful. And it's been tremendous. And hopefully we don't get mask fatigue and that stays the way it's going to be, because it's really been excellent. With a little bit less than 20% of the population that chose distance learning, that actually helped with very favorable class sizes in terms of helping with the social distancing. So that's also been a positive. On the more challenging side, obviously, 2 positive cases. I cannot thank enough Jennifer Curtanis for her partnership in dealing with those isolated cases. I have learned a lot about contact tracing since last Friday. And I think it is really important for the public to understand the definitions of when a health district is going to go look at close contacts, that it's about people you've spent 15 minutes or more within 6 feet of, and by that definition, we should have very few close contacts if we're doing what we're supposed to do. And even in the school setting, we can really limit the number of close contacts that people have down to a limited number of people. So in both the case at Squadron Line School involving a student, and then last night's case involving a staff member at Simsbury High School, we were able to determine that in the school setting, those people had very few close contacts, and therefore limit the number of people who needed to be isolated to a very small number and keep the operation moving. And that's important. We've gotten a lot of positive feedback about not overreacting. Of course, some people are on the other end of the spectrum thinking that we should be shutting the school down if we have a positive case. So we know the opinions on that vary, but we're really grateful for the guidance we've gotten to be able to keep going with the cases that we've had. So both the student who is going to be returning to school soon is doing very well, and I spoke with the staff member last night who is really just experiencing a cough, but is otherwise doing pretty well in terms of his symptoms. So that's about what I have, but certainly stop if anybody's got any questions.
No questions? Okay, thanks, Neil. Thanks for jumping in there too. Appreciate the update and what you guys are doing to keep my kids safe. If anybody else has any other open business, comments, questions they want to bring to the table? Once, twice, 3 sold. Okay, great, guys. We will adjourn the meeting of the, whatever today's date is, the 16th of September of 2020 Public Safety Committee meeting. I hope you
Can I
guys all
jump
have
in?
Oh, gosh.
I'm so sorry.
Maria.
Just a quick reminder for the next meeting. It's October 15th at 8 a.m.
I've got that one on my calendar, Maria.
Okay. Sorry.
Right.
Some were regular meetings and some were special meetings. So if we accidentally or an error left somebody off of a calendar invite, I'm so sorry. But October 15th at 8 a.m. Same Zoom link.
Great. Thank you, everyone. Well, hope you guys all enjoy. It looks like it's going to be a beautiful day outside. Thank you for spending the time with us this morning. Have a great day. Bye now.